Okay, we're back with Dr. Lokna, live in studio. Thank you for that great talk, Dr. Lokna. We have a bunch of questions for you. I don't think we'll get through all the questions that came in, but now you're getting the larger umbrella of questions around this idea of fitness and lifestyle for a well life. So the first question is it ever too late to start making lifestyle changes or exercising?
Yeah, so the principles around lifestyle medicine and those pillars that I was addressing, they are really a framework that are appropriate for all ages. So it's never too late. Our body is a resilience machine. It's made to make changes. It typically has an affinity toward positive changes, and it's self-reinforcing as you're doing small things that add up to feeling better, having more energy, getting more rest, getting more movement. It's never too late to start.
Okay, well, another kind of a follow-up question then is, this idea of active life versus a planned exercise life. So what do you think about that?
So my first answer is that it wouldn't be either or, it's yes and I'll give you a couple of examples. I don't think we can substitute the benefits of an exercise routine that is deliberate in terms of how high our heart rate goes, how much strength training we're doing for building muscle. But on the other hand, those aren't the only times that we want to be active and moving. So we know this about blood sugar metabolism. We know this about help for sleep, restorative sleep cycles. So here are two examples I would give to you. Most of us in offices have seen the trend towards standing desks or a walk. I have a colleague who famously uses a walking treadmill desk. These are fantastic, what I would call active lifestyle interventions. So they all count toward movement and exercise. The 5 to 10 minute walk after you eat is a great efficiency mechanism for improving blood sugar and metabolism. All examples of active lifestyle. Move when you can.
So one of our listeners has said that they exercise regularly and would like to gain muscle, but they don't seem to. What are they doing wrong and what could they do right?
So a couple of things about muscle. This is a big question, and we're all slightly different in terms of the way we look, in terms of our ability or ease with which we can make muscle change visible. I have two thoughts. One is around measurement to see if there really is some growth and change in skeletal muscle mass. There are techniques that offices use that measure body composition, and one is called a DEXA scan. We do this commonly down at our C Street office, and it's a 6-minute scan, and nothing touches you. You lie on a platform, and machine scans and tells us what the percentages are of our body composition, the lean muscle mass, skeletal muscle mass, et cetera. So you may be building more muscle mass than you think you are. And one measure of that would be to test body composition maybe once or twice a year to see where your trend is going. And the second answer goes back to what I mentioned in the talk, progressive resistance overload. So the way to get adaptive change for muscle is that the target needs to keep moving. If you begin with a program that is light on resistance training and it feels effortful, that is a moving target in order to affect change for muscle growth. There needs to be other ingredients as well. I mentioned the adequate support for protein. That's the building blocks largely for what we're doing in terms of improving muscle growth, hypertrophy, strength training. All of those have different parameters around reps and different sets. But measurement to see where you are and making sure that your program is changing so the target is moving helps to give that progressive overload a chance to work.
Great. Switching gears now to stress that you mentioned prominently in your lecture, with people who are caregiving for lifetimes, widowhood, grief, etc. Do you have any specific examples or advice for giving or for attaining long-term relief of stress?
Yeah, and this is a big, very important topic, I think, for individuals, for groups of people, for our communities. And there is a researcher and an author who's been very helpful around stress resilience, and I've really greatly enjoyed her work, Dr. Elise Epel. There are lots of good studies that show the importance of building into a lifestyle time for restoration so that our nervous system gets to quiet from the fight, flight, chronic stress load response. And even if, especially if the situations that contribute to chronic stress are not changing anytime soon, simple practices like breath work, getting time out in nature, things that we do to regulate our nervous system, meditation, prayer, social connection, these are not intended to be quick fixes to manage stress, but they're really intended to help co-regulate our nervous system to be able to develop a little bit more resilience and balance so that our body and our mind and our emotions can handle the sustained load. So there's good data behind meditation, behind mindfulness practices, breath work, nature, movement. Those would be my suggestions in terms of building it into a lifestyle.
We're going to take one last quick question about melatonin as a sleep aid. Is this one that you would avoid, or what are your thoughts on melatonin?
Yeah, this is a big topic. Thank you for asking this one. I was pretty negative about sleep aids that were over-the-counter, things that people take for sedation. I don't put melatonin in that category. I think that individuals have different responses to melatonin. Lots of the dosing is a little bit less regulated than we'd like to see as a supplement, but for some people can be very, very helpful in terms of a supplement to help facilitate sleep. Again, I didn't put that in the same list as I had for the ones that I actively hope that people avoid.
Well, thank you, Dr. Lokna. Wonderful presentation.
My pleasure.
We're gonna have to stop here. We could probably go on for another hour with Q&A, but we're going to have to stop here, and we'll take a very short break. And at 11 o'clock, we'll be back with Professor Siminovich with his talk on lighting and wellness.